All right, today we are going to demystify a therapy that's getting a ton of buzz for tackling one of the most common complaints out there, that stubborn, nagging muscle pain. We're talking about dry needling, a really modern approach that, well, goes right to the source of the problem.
You know exactly what I'm talking about, right? That deep, annoying ache in your shoulder or your lower back. It feels like a tiny, hard little marble that's buried deep inside your muscle, and it seems like no amount of stretching or massage can ever really get to it. It's just so frustrating, and it can seriously get in the way of how you move.
So, what exactly is that stubborn knot? Well, in the world of physiotherapy, it actually has a proper name. And just understanding what it is, that's really the first step to finally getting rid of it. I think this is the perfect way to picture it. That knot is basically a tiny, clenched fist deep inside your muscle. Now, the technical term for it is a myofascial trigger point. It's just a small patch of muscle fibers that have contracted so tightly that they've actually choked off their own blood supply. And this can cause pain right there, but also, weirdly enough, in other parts of your body too. So how do we even get them? Well, it's pretty much a list of all the usual suspects of modern life. Everything from being hunched over a desk all day to maybe a workout where you pushed it a little too hard, an old injury that never quite healed right, or even just the day-to-day stress of life can cause these trigger points to pop up. Okay, so now that we've kind of put a name to the problem, let's talk about a really targeted solution. How do we get that tiny clenched fist to finally let go? Okay, here's the core concept. A trained physiotherapist takes a very fine, sterile needle, and that word dry, by the way, it just means there's no medication being injected, and they insert it directly into that trigger point. The whole goal is to get a specific response from the muscle that helps release all that tension, improve blood flow, and basically just reboot the muscle. And this is a really important point. This isn't some ancient practice that's been around for thousands of years. It's a modern therapy, and it's completely rooted in our current understanding of anatomy, the nervous system, and how our muscles are supposed to work. And that scientific foundation, well, that brings us to a very common point of confusion. Look, I get it, they both use needles, but honestly, that's pretty much where the similarity ends. So let's break down the key differences, because this is the number one question everybody asks. So the bottom line is the why. Dry needling is based on Western medicine. It uses a modern map of anatomy to find and target a physical thing, that trigger point, to relieve pain. Acupuncture, on the other hand, is based on traditional Chinese medicine. It uses an ancient map of energy pathways, or meridians, to influence the flow of energy, or qi, for a huge variety of conditions. So, completely different maps and completely different destinations. So, who actually ends up benefiting from this therapy? Is this something that's just for elite athletes, or, could it actually be for you? As we go through this next slide, I want you to think about any of those nagging aches or pains you might have. Just see if any of these symptoms sound a little too familiar. If you're sitting there nodding along to this list, whether it's those tension headaches you get from a stiff neck, a shoulder that just won't move the way it's supposed to, or that nagging pain that sticks around no matter what exercises you try, well, dry needling might be a really useful part of a physiotherapy plan that could help you out. Okay, let's talk about the elephant in the room, the needles. The idea can be a little intimidating for some people, for sure. So let's just pull back the curtain and demystify the process. Let's run through exactly what happens, because it's a very controlled and professional procedure. And this is so important. This isn't some standalone magic trick. It's actually part of a much bigger, comprehensive plan. Your physio will first hunt down and identify the exact source of your pain. Then, after the needling is done, they'll integrate it with specific exercises and stretches to actually retrain that muscle. It's all about focusing on long-term function, not just a quick fix. All right, let's do a little rapid-fire round of the most common questions, starting with the big one, the one everyone wants to know. So a lot of the time, you honestly won't even feel the fine needle go in. What you might feel is this really strange, brief, involuntary muscle twitch. That's called a local twitch response. And as weird as it feels, it's actually the golden ticket. It's the sign that the trigger point has been found and it's starting to release. It's the proof that the therapy is working. Next up, the really critical question of safety. And this one is super straightforward. The safety of this whole procedure comes down to one thing: who is doing it? When it's performed by a licensed professional who has specific, advanced training and certification in dry needling, it is a very safe and controlled technique. And finally, what about after the session is over?
What can you expect once you walk out the door? Yep, some mild soreness is pretty normal. The best way to think about it is like the feeling you get after a really deep tissue massage or maybe a really tough workout. That muscle has been stimulated to create a change, so a little bit of soreness is actually a good sign that the therapy is having a real effect. So let's zoom out and bring it all together. What's the ultimate payoff here? What's the end goal of all of this? I absolutely love this quote from the source material because it just perfectly captures the two-part mission of this therapy. It's not just about getting rid of the pain, it's about getting you moving properly again. And this right here is why it's used as part of a bigger physiotherapy plan. Releasing that knot, that's step one. Step two is using that new freedom to strengthen the right muscles, improve your posture, and build better movement patterns that hopefully prevent the problem from just coming right back. So we'll end with this thought to chew on. In a world where we often just reach for a pill or try to push through our chronic muscle pain, therapies like dry needling are asking us to think a little differently. They challenge us to find the specific physical source of the problem and address it directly, which really makes you wonder, what other targeted solutions might we be overlooking? Something to think about. Thanks for joining me for this explainer.